Hi, I'm Nic Brown from Integrative Physiotherapy and welcome to our YouTube channel. So today we're going to be talking about how to exercise when you live with ongoing pain. Remember, this video is for general information only and is not intended to be used as individual medical advice. There are a wide range of benefits of exercise for our health, and if it were a pill we would all be taking it. So research tells us that exercise can help regulate sleep and reduce fatigue. It reduces inflammation, which is the underlying problem for a lot of health conditions. Exercise increases our brain size, improving memory and concentration, which is often a problem for a lot of people I see. It also reduces the risk of developing diabetes, having a stroke, many types of cancer and dementia. There is also a role in the management of depression and anxiety and improving resilience to stress. There are the other well-known benefits such as strengthening muscles, reducing the stiffness in our joints, improving bone density, digestion, heart health and circulation. And there is good evidence that exercise helps with both pain and improving function in conditions such as back pain, arthritis, both osteo and inflammatory, fibromyalgia and cancer. So this all sounds great, but let's talk about the challenges now as to why we aren't just all getting enough exercise. So being active can be difficult anyway in modern life and fitting it in, but there are additional considerations when you live with persistent pain, and people don't always know where to begin. Good intentions can end up in a pain flare-up, sometimes lasting a few days, which can easily put you off trying again. So where to start? I would begin by thinking about something we call your baseline, which is the amount of activity that you can do one day. I'd be quite confident you could repeat it a number of times over the course of a week. And this is whether you're having a good day or a bad day, and without it leading to a significant flare-up of symptoms. Now, this stage can take some trial and error, as there are no hard and fast rules. You could think about how much you can do on a good day and halve this amount in time, repetitions or distance as a rough guide of where to start. And this is to avoid that boom-bust approach where we tend to overdo things on a good or better day, when we feel a bit better, and then tend to rest more on a bad day. The next stage for some people is grading this up. So once you've found an amount that feels doable, and you've been able to do this for a week or so, and you've been okay with that, you can start to think about increasing the intensity or duration of what you're doing by a small amount. As a rough guide, it's that 10-20%. So if you're walking, you could cover a greater distance in the same time, incorporate more slopes or uneven surfaces into your routine, or increase how long you're going for. So a 10-minute walk becomes a 12-minute walk. If you've been doing strengthening exercises, you could increase the weight you're using, or the number of repetitions or sets, again sticking to that 10-20% as a guide. Consistency is key, so little and often is more effective an approach than doing it in fits and starts. Your baseline won't stay the same forever, and hopefully over time, by starting small and building slowly, you will gradually be able to increase the amount that you are able to do. Our tissues, nerves, muscles, ligaments, tendons, joints, they can build a tolerance to the movement or activity that you're doing, and our bodies learn that it is safe to move again. So what's the best exercise to do for pain? Well, it's the one that you enjoy and will keep doing. There is very little evidence that one type of exercise is better than another, and it is more about doing an exercise or movement that your body enjoys and you are able to incorporate regularly into daily life. So some things to remember. Try not to be tempted to progress too quickly. You do not always need to get to 10. For some people, doing 3-4 repetitions or minutes will be right for them. It's not necessarily about pain-free exercise, especially if you already live with pain all of the time, but it's finding an amount that doesn't flare you up later and that you feel that you can do regularly to gain the most benefits. Not everyone will be able to grade up the amount that they can do, and that's okay too. I think finding something that feels doable, that you enjoy, should be the main focus. Try not to compare yourself to what you used to do, what you think you should be, what others are doing. Remember that your body has been through a lot, and it's about approaching this with compassion and kindness, and not beating ourselves with a stick. Recognise your achievements, I think, is really important. Write them down, get a journal, notebook, tell someone close to you, however small it feels at first. If you prefer this in a written format, then look out for our free guide on how to exercise when you live with ongoing pain, available through the website and also on social media. So thanks for listening today. Remember to subscribe if you'd like to keep up to date with the newest releases, and share with anybody that you think needs to hear this today. Bye for now.